Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to State's Response to COVID-19. My name is Kiami Harris and this is part 1 of a webinar series. We thank you for joining us today. We have quite the number of registrants and I see you all coming in very slowly. I'll give you a minute. As you're coming in, I just want you to know that this session is being recorded and we will share it in a follow-up email along with the slides to this session and all of the links. This session will be found on our website, childcareaware.org, on our COVID-19 page. So we invite you to use that website, that web page for COVID-related information. Also want you to know that we will be having a question and answer session at the end of the presentation. So we invite you to use the questions box to put all of your questions there. In the event that we don't get to them, we will try to compile them and share out answers to some of your questions in a future email. I want to introduce to you our Executive Director, Lynette Fraga. She began her career in early childhood as a teacher of infant and toddlers in preschool classrooms and has held positions in local, state, and national levels within nonprofits, corporate, and higher education sectors. She earned her doctoral degree in family studies from Kansas State University and a master's degree in human relations from the University of Oklahoma and a bachelor's degree in special education from the University of Arizona. Now, I'd like to turn it over to Lynette.
Thank you so much, Kiami. Hello, and thanks to everyone for joining us for this webinar series about how states are responding to the coronavirus pandemic. We've seen wide variation among states, including on childcare. For the latest information, I do encourage you to visit the state-by-state map on our website at childcareaware.org. In each part of this webinar series, we will focus on the decisions that states have made about important childcare issues, including emergency care, supporting families with critical childcare decisions, childcare subsidies, and supporting providers to care for our essential workers' children. Today, we'll take a look at 2 states, Vermont and Minnesota. They have been very focused on supporting childcare during this pandemic and can serve as models for other states. I'm so pleased that we have 2 wonderful childcare leaders from both Vermont and Minnesota that I think are amazing with us today. I'd like to turn it over to Ami to introduce them. Ami?
Thank you so much, Lynette. Joining us first is Allie Richards, who is the CEO of Let's Grow Kids. Allie draws on her extensive experience in state and national politics and her leadership in education policy to spearhead Let's Grow Kids' mission. Prior to joining the organization in 2015, Allie served as the Deputy Chief of Staff for Vermont Governor Peter Shumlin, where she led several efforts to support early childhood education, including winning competitive grants, federal grants totaling $70 million, and supporting the passage of universal pre-kindergarten. Allie was selected as a 2013 Toll Fellow by the Council of State Governments and as the 2014 Vermont Champion for Education by the New England Secondary School Consortium. She grew up in Newbury, Vermont, and now lives in Montpelier with her husband and twin babies and dog. And next, after Allie, you'll hear from Ann McCully. Ann is the Executive Director of Child Care Aware of Minnesota, where she joined in 2002. During her tenure, the work of the agency has expanded to include the Eager to Learn online training program, the Teach Early Child Minnesota and CDA scholarship programs, the Retain Workforce Retention Grant program, and Parent Aware quality rating and improvement system implementation. She is active on several state-level work groups focused on policy and systems change. Prior to Child Care Aware of Minnesota, Ann served as the Midwest Director of Government Relations and Advocacy for the American Cancer Society. Ann has a Bachelor of Arts degree in Speech Communications from the University of Minnesota and she lives in South Minneapolis and is the proud mother of 2 young adults. I will turn it over to you, Allie.
Wonderful. Thank you so much, Ami and Lynette and Kiami. It's my absolute honor to be here discussing what Vermont is doing right now in this unprecedented time. And I just first want to say to all of you listening, thank you for being on this call. Thank you for all I'm sure you're doing in an incredibly tough situation right now as we're facing something that really we've never been faced with before. So let me tell you a little bit about Vermont. First, let me say what Let's Grow Kids is. We're a nonprofit organization, and we have a mission for high quality, affordable child care for all who need it in Vermont by 2025. And it became very, very clear the moment this all started happening that we had to cease all operations and do whatever it took to get the child care industry in Vermont through this crisis right now. If you can please advance the slide. So we're a conglomeration of parents, educators, community leaders. We really have our ear to the ground. What became obvious immediately is that we needed to work with state government in a public-private partnership immediately. And luckily, we had been developing those relationships over time. So we were able to jump right into that role, which we've seen in other states as well become pivotal right now, where you have trusted relationships in a private market. And so you have your ear to the ground for both families and the field, and you can provide a feedback loop up to state government. So next slide, please. What I would say is that the state of Vermont, thankfully, has realized in this crisis that childcare is absolutely critical, not just to have Vermont get through this virus response, as in it's a backbone of our response for caring for essential workers' children. But it is also so clear that when we get through this and the dust settles, we have to be ready to let the childcare industry just pick right back up where it left off. And lots of years of groundwork of sort of publicizing the importance with lawmakers and decision makers, our administration. We have a heavily Democratic majority in our legislature, but we have a Republican governor, and we have a large progressive group. So this has become a tripartisan issue, and the groundwork we've been able to lay to say that child care is essential. I think as a nation right now, we're all seeing that in stark relief, and we're trying to make sure that we keep that drumbeat going in policies, both with the emergency stimulus and bailout packages, but also with how we're stabilizing this industry to get through. So let me take you step by step of what has happened to really have the state of Vermont quickly within one of the first things it did in its response is elevate the child care industry in a few ways. So step one, on March 17th, so very early in the crisis, our governor directed that child care programs close except for the care of children of essential personnel. And I will just quickly say, this is what my house looks like. This is Bo and Wesley, my 16-month-old infant twins. And this was our first day at home, working from home and juggling care at home when our child care closed. So this was really crucial for a couple reasons. We were actually very, very vocal in making sure they made this decision because what we found was when they made the decision to close the schools, our childcare industry frankly felt ignored and invisible and disrespected, even though it's a private market and it's a much more of a public-private partnership than our public school system. We had guidance immediately from the schools that was based on public health and other factors, and leaving the childcare industry out of the initial announcement created chaos. And so we quickly got the governor to step back up and a day later say, actually, childcare must close as well for all the same reasons we're closing the public school system. So that was a crucial first step. And frankly, we were listening to NACI and other national groups that were issuing this guidance saying that is best practice. Step two, it became, next slide, please. It became clear that we had to make sure folks who were doing this work, basically stepping into the front line, were getting financial support for doing that. So we were advocating tirelessly, hearing from the field, saying, we cannot move forward to offer care for essential employees if we don't have very good sort of incentive, financial incentive. And so what the state of Vermont did was they offered $125 per week per child in addition to regular tuition, which comes into play, which I'll talk about next with the Child Care Stabilization Grant. But in other words, if you are caring for your essential workers, you will get all the same funding that you will be held completely financially harmless. which I'll go into more detail momentarily. And in addition to that, you will get $125 per child per week. And we've now have the private childcare settings providing care for school-age children as well. So in Vermont, it's birth to grade 8 that is being cared for essential workers right now. And it's in the private setting. In some cases, it is schools, but it is the child care system is also now working with the school-age children. They get $200 additional as tuition, so the parents pay nothing for school-age kids, and so that's really a $325 per child per week amount if you're taking school-age kids in these settings. So this can be used, and it's at the purview of each program to increase the wages of their workers or to pay for cleaning supplies and safety protocols and other things like that. Step 3, what we were able to do is provide customized health and safety guidance, training, and resources for the child care folks that were reopening to care for essential workers. This was crucial. There was hesitation at first, even with the financial incentive, of course. You know, folks are being told to stay at home. Why should we reopen? We're having pretty much daily contact with our public health officials, our head of maternal and infant health, as well as our epidemiologists, saying specifically to childcare, is it safe to do this work in this congregate setting? We're starting with the point, again, that Macy made, that in this time of trauma and uncertainty, a well-prepared early childhood educator is absolutely a crucial player for these children and these families that are going through this very difficult time in these transitions. So it's a really wonderful thing if folks can actually get care in the setting that they're used to. And so all of these policies are coming together to support that. The best case scenario is, if you're not worried about going bankrupt as a child care center, you have a financial incentive to care for essential employees' kids if you had them in your care, and you're going to get really up-to-date customized health and safety guidance. And so in Vermont, that means things such as, of course, no more than 10 in any setting. Many are choosing to do even less than that. That's for the adults and the children in the group sizes. They have just-in-time direct contact with maternal and child health nurses, and they're also doing screenings directly in the program. So we're making sure everyone has the protocols for that, support from these nurses as needed. If they need that on site to be comfortable, they get it. They have sort of the guidelines to say, please take your temperature at home. No one comes here sick. And we all know that that's a policy that's current in childcare, regardless of being in a pandemic crisis. However, we're hearing from our providers that it was incredibly important for them to sort of have this authority from the public health folks sort of saying it on their behalf, so they could be absolutely clear about no one comes sick, adult or child, and please take your temperature at home, and we're going to be also taking your temperature on site as you enter. So we've done a webinar in addition, sort of in concert with the health officials and our child development division. We're going to continually do these webinars that are oversubscribed. They're recorded and sent out afterwards for everyone doing essential child care for essential workers in Vermont. Step 4, what we were able to do is this, continue our subsidy and public pre-K dollars flowing, not due to attendance, but with enrollment. In other words, every single child care financial assistance dollar, both through our state funding and our federal CCDBG grant funding, flows to our programs. It has not stopped. Business as usual, this money is getting into those programs' hands. We're also having our pre-K dollars flow exactly the same way. So many folks closed down, and they're staying closed. They're keeping their early educators on payroll. Those folks are reaching out regularly to their families. They're doing story time. They're doing FaceTime. They're doing music circles. They're also doing professional development. And so they're on payroll. The programs are staying intact, and the pre-K dollars and the child care financial assistance dollars are flowing. Now, next slide, please, step 5. This is the crucial sort of final element of this. As I mentioned earlier, our whole point was we must close down these child cares just as we're closing down schools. That's best public health guidance right now, and we don't want to leave it to these individual programs to have to juggle the choices of caring for their families, not going bankrupt themselves as businesses, and making the right public health choice, which is why it was very clear that the first thing that had to happen was with the school closure notice, to close childcares as well, but then allow them to reopen for essential employees and have that be the focus. We all knew no way childcare programs could reopen to do this crucial work to care for children for essential employees if they were worried about their bottom line. So the really key thing that the state did here, and we were the first to be able to step up, and the state said, we're going to hold you harmless financially through our stabilization program. And what happens is we're asking parents to pay 50% of the tuition that they normally pay. So that's 50% of a copay if they were on subsidy, or 50% of their private tuition if they're private pay families. And if they cannot do that because they choose to, they absolutely just can't make it work financially, or for some other reasons they just will not do it, the state will pay the full tuition to that child care program. So in essence, every single child care program in Vermont through this emergency state funding is being held harmless financially. They're going to come out of this whole. And the reason, it harkens back to the first thing I said, the reason why this is being done is because the state said almost immediately in this pandemic response, we know that we can't function as a state through this pandemic if we don't have childcare for our folks who are on the front lines. And we know we can't function as a state if our childcare businesses close. We heard from the field, we heard from Macy's and Childcare Aware doing incredible work at the national level, telling us that we won't have, half of these businesses within 2 weeks. We know that these programs operate on such thin margins as it is. So we were just faced the stark reality. We prioritize the childcare industry because we know we need it when this is all over. And so the stabilization program is really there for that exact reason, to make programs basically whole, so they can continue business as usual, pick up exactly where they left off when this is all over. Now, I will say this is not without its challenges, and we're continuing to work through that. For example, some parents are saying, I can't afford 50%, or I don't want to afford 50%. Why should I be paying for a service I'm not getting? And the great news is that the childcare programs that have really stepped up here are showing what a value they're adding to their parents. They're there as a resource. Some of them are supporting them through behavioral issues, some of them supporting them through how to get by the day, juggling at-home childcare, as well as working in some cases, how to create routines, offering other resources, and they're also really stepping up. We have enough currently supply to meet demand for childcare through this system for our frontline essential workers, and that is due in large part to this program that's basically keeping these programs whole and intact, and their folks on payroll right now through all this. So next slide. I'll just close with a few broad points about what I started with. Again, it was incredibly helpful. We just so happen to be an organization. I know so many of your states have organizations like this that could act nimbly because we were in the private sector. We could sort of call up state folks that were working through red tape and working through the bureaucracy and say, we know you're trying your best. We know you're working hard, but the chaos that is, happening in the field right now because you aren't getting clear and timely communications, because you haven't issued guidance, is really damaging. And we give it about a day until the system implodes. So please prioritize getting this guidance out now. And that really helped. And we had real stories from folks on the ground, parents and, and childcare providers and employers in many cases. That's what I would say is incredibly important to have a public-private partnership at this moment. The other thing that we're able to do is feed information directly to our federal delegation. So we're kind of in this interesting place of being sort of directly on the ground, feedbacking questions and concerns to the state and to our federal delegations. And at the same time, it's in reverse order where we're hearing from the federal delegation, our senators and representatives in Congress. We're hearing from our state officials, and there's, as you all probably are experiencing, there is so much incredible information right now, and some of it is very dense. So we're playing a real translation role, I would say, by digesting that information constantly and putting it out almost daily in a way that is more accessible to the field. So next slide, please. I'll just summarize, I guess I would say, what a couple of the other things that we're doing. So in addition to being that sort of feedback loop, creating the digestible resources at our website, Let's Grow Kids /coronavirus. It's not just for employers, as you see here on the link, it's also for parents. The state asked us, we just don't have the capacity right now to be, you know, a resource for parents in the way that we want. Can you create and collate guides for, you know, mental health and self-care and tips with working with kids and things like that? So we partnered with our Building Bright Futures, which is our Early Childhood Governance Council, to do that, to create webinars, just-in-time work. We're also continuing to help create the infrastructure for childcare for essential employees. And I will add one element of this that you're probably wondering about. Some folks do not want to have care in congregate settings in our regulated childcare system right now. They're choosing not to, or for a variety of reasons, they can't. And so there is an informal element that's cropping up that the state asked us to be in charge of on the side of this regulated system. And it's basically just filling gaps. It's basically just a full court press for whatever it takes for folks to get care right now for essential workers. And right now in Vermont, that's looking like we have a 211 system, as many of you do, a phone information referral system. And it basically is acting, we were using it for Help Me Grow, actually. So we've already have it set up, a whole crew of folks that are working at our Help Me Grow call center in Vermont, which many of you have. And they are becoming the informal referral intake and referral for those that want to be matched up to informal care. And what I would say about that is that we have a whole crew of medical residents who cannot be working right now because of this crisis protocols in healthcare, and they're already fingerprinted and background checked, and they have CPR, first aid plus. They're ready to volunteer and go into homes, especially for their colleagues, and watch healthcare workers' kids in home. So we're setting up a sort of secondary informal system. I also will say one other thing about what we were able to do. The state said we need an intake for essential workers. Who are they and what are their childcare needs? So we put a web form, a very simple web form up that could be edited in real time. So as our essential worker definition changed, the web form could be changed. We blasted it in every single network that we all had. So it was more of a public PSA, and it's how we're collecting information from essential workers to hear what their childcare needs are. We send that information to our resource and referral agencies. So we're using infrastructure we already have in the state. Our backup is our 211 system. So they are also acting as a referral. They plug the information in for families that don't want to use the web form. It's just easier for them to use the phone. They're giving that information to our referral networks. Those referral networks know which childcare programs are operating right now for essential personnel, and they're linking families. And then our child care development division is following up with phone calls to these families to make sure they've been placed. The final thing that we then have been able to do is create a collector tool for those that are doing the child care for essential workers and saying, what do you need right now? Because you can imagine many of them don't have health insurance. Some of them don't have toilet paper anymore. So what we're doing is getting a collector tool to get all of the needs, from staffing to insurance to resources like Clorox wipes and toilet paper, in one spot. And then we're sourcing all of that in bulk from on the ground folks that are doing this. Some businesses are stepping up, and creating sanitizer, producing toilet paper, and we're linking those together. And we're actually having volunteers do the drops now regularly at those childcare programs. So final slide. Actually, let's skip right to the last one. So yeah, in closing, I guess what I would say is we've really found that some of our value right now is not just being a trusted partner, both to the state and to families and early care educators on the ground, but also a cheerleader. It's been a hugely important role that we're playing. This little mem shows you actually a parent drew this for us and sent it in. We're blasting it everywhere on social media. Please don't forget that childcare, educators are absolutely on the front lines and essential employees themselves. And frankly, they're behind so many of our other essential workers in other sectors. And so really trying to make sure people are respecting this field and understanding just how crucial the stabilization in these federal and state dollars are, and how appropriate it is that they are going to this field. So I look forward to the question and answer session. For now, I'm going to turn it over to my colleague Anne in Minnesota, a kindred state, who's doing wonderful things as well.
Thanks so much, Allie. Wow, impressive. I wish we could go as far as you did. This is Ann McCully in Minnesota. Allie and I were comparing notes that we have snow in both of our states, so at least you don't all have that, perhaps. I'm Executive Director of Child Care Aware of Minnesota, so we are the coordinating network that supports the system of 14 agencies in our state that do the on-the-ground work of child care resource and referral, or Child Care Aware. I told Allie she's putting me to shame because I had no time to prepare a PowerPoint. So what Cami has on the next slide is just links to a couple of websites, and I think those are going to have to act as our visuals while I talk. So Cami, if you want to go to that first one, the .gov, we'll sit there for a second and I'll do some lead in. This journey for our state, like many of you probably, began, in my case, it was an 8 a.m. phone call that I have saved on Sunday, March 15th from the governor's office saying in 2 hours, the governor's going live at a press conference to announce the closure of schools. Schools will instead be directed to take care of children ages, well, primarily kindergarten and on up, but potentially for enrolled voluntary pre-K program children, which is not that many in our state at this point. But he's going to call on child care programs to remain open and take essential workers. We had about a 24-hour time after that to pull in some of our additional staff. And I should say, like many of you, this is against the backdrop of we had already sent our staff home to work remotely that Monday. A few of us were still able to come in, but by and large, we were already set up remotely. We were asked to then become the repository of calls from parents who needed childcare, particularly essential workers. So Cami, if you want to click on the families, this is a landing page that is now the state of Minnesota. They have been keeping this updated. And if you scroll down, you will see here what they have done is through our Office of Management and Budget, they've posted a survey, a very simple, SurveyMonkey survey that gets updated every day, really encouraging providers to come on here, update their data in terms of what they have available in terms of capacity. And then that gets sent over to us on a nightly basis. We debated updating our existing database. Many of you probably have Macaware or something similar, but our concern was, A, it's moving so quickly, and B, these are temporary, we certainly hope, closures and openings. So we wanted to work more rapidly than that. I've joked with some people, I feel like we're back to the earliest days of CCR&R where we're working off not index cards, but a spreadsheet. But hey, it's working. And now, initially this map did not exist. It was purely a spreadsheet that we had gotten to our staff. We were able to shift about 4 of our other staff off of other projects and have them as backup for our 3 child care information services staff that normally will talk to parents on a daily basis, but now we're upwards of 400 calls in the last 3 weeks from parents looking for care. Once they created this map, it was really helpful because we could also direct parents to look at this and then still call us if they had questions or needed help. And of course, like any of you who run call centers know, even though we are promoting that phone number as the place for parents to call, those folks are fielding so many other questions from providers, from other organizations. They're just doing an amazing, amazing job. So that was the parent piece. At that point, and Allie, you reflected on it, we also felt that there was a disconnect here in that the fact that the providers were not being reimbursed in the childcare community. Schools had funding to do this, childcare providers did not. So very much like your story, a whole raft of advocacy organizations came together. Many of us had been working collectively, hoping to do finally getting some movement on our childcare assistance, our subsidy program in Minnesota. In fact, we were poised on the edge of where we thought we finally were going to see an increase in our reimbursement rates. We are still out of federal compliance. That same coalition quickly pivoted and started working on this push to say we have got to have both short-term and long-term supports for our child care community. There is no way from an equity standpoint, from an everything standpoint, if we're going to ask people to step up and do this, we have got to be able to give them reimbursement or some kinds of supports. So that kind of came in waves. The initial supports were done administratively, some of the same things Allie talked about, flexibility from our licensing division, and there's a separate hotline that's available on the provider side. If you do want to go to the provider side, Cami, this is updated. I think we're getting daily updates. I just got one before I got on this call about some arrangements they've been able to make for supplies. So they're constantly updating this and sending out e-blasts as new changes are announced. But initially it was things like flexibility with your license, a hold on needing to renew licenses. We are a bit hand-tied because so many of our subsidy issues are in statute rather. So it would take the legislators to make changes, but they went as far as they could administratively. And then I've got to look at my dates here because it's all such a blur. The legislature, of course, stopped working in person as well. There was a pretty historic effort, though, to bring together an agreement around a broad package of supports. So the understanding was that the governor's office, the House and Senate, both parties in the House and both parties in the Senate, so it was a 5-way agreement, had to happen. They managed to hammer out an agreement, bring it to the floor last Thursday, do a rather unique way of voting where they had senators and reps scattered all over the building so they weren't over the 10 people rule, brought them in groups to vote, basically managed to pass a $330 million package. 30 million of it is going for childcare. And very specifically, it is going for what we're now calling peacetime emergency childcare grants. That's going out to both family childcare and center. Good job, there we are. She's reading me. This is our website because we are the ones distributing these. And it has been, so it got passed last Thursday. We did not even see the final language until that morning. It was signed by the governor on Saturday and we launched this on Wednesday, which explains to you why I did not have time to do a PowerPoint. We were waiting on the governor to officially announce it Wednesday evening or late afternoon, but we had the site live to be ready. Before he even announced it, people were coming on and filling out applications. By Thursday morning, we already had over 2,500 applications. We are now over 4,500 applications and counting. That already reflects about half of our population of childcare settings in Minnesota, and they have until April 15th to fill it out. So we knew from the beginning that the first thing I said to our staff was, we're going to have people upset with us. It's just a question of who. So it's there's no way it even begins to cover the need, and we've tried to make it extremely clear through all the associations, through all of the partnerships we have, that this is first and foremost about opening your doors or extending if you're already caring for emergency workers, and it's not going to solve all the problems. We are well aware of what a dire situation it is. We are trying to use, though, the fact that there's been such a swell in applications to demonstrate the need, and again circle back with all these other advocacy partners to try to make that next push for the next package, which really is going to be about how do we get our whole childcare community back up on its feet, because we know as eventually, and I keep saying we will get through this, there'll come a time when we're going to have to restart our workforce and our economy, and they're going to need childcare. And we do feel this has been one way, at least, to really illustrate, sort of lay bare the challenges of how we call it a system, but as we all know, it's really a collection of both small and large businesses, centers. In Minnesota, many of you heard me say, who've heard me present, we are relatively unique in that the vast, vast majority of our settings are family childcare. We have 7,400 as of right before the pandemic, family childcare homes, and fewer than 2,000 centers. So it is a huge presence in our community. That brings me to one thing I wanted to say that looks different from what Ali said. There is a very strong push and recommendation by the governor that our childcare programs let everyone else go and only care for essential workers, but it stopped short of a mandate. In a sense, because 2 weeks ago, we, like many of you, went into a shelter at home period. In a sense, that's what's happening anyway. And yet, if you define the most broadly who is an essential or critical worker, I believe our Commissioner of Commerce said it was 78% of the people working in Minnesota still fall into one of those categories. So in a sense, de facto, they are caring for those folks, but to get this grant, they have to prioritize caring for those tier 1, as we call them, and tier 2 essential workers, and that's spelled out in the guidance. So we've been so busy with it, I haven't even stopped enough to think about what we're learning, and we're building the plane as we fly it, but these will be monthly. The understanding is they will get this grant. We will have them out the door the week of April 20th. and then we will have them re-up in May, and if it goes into June, it goes into June. Right now, the money is forecast through the end of June, with the understanding that if there is a sudden, heaven forbid, hotspot or community where we suddenly need to shift resources and find more childcare, then we need to have some flexibility with the funds. But to the extent possible, we will fund people ongoing. The range is from $4,500 for family childcare. That's the base. They can get an additional $1,000 per month if they are either offering non-standard hour care or are willing to take children who are English language learner children or special needs children, or both. And then our centers will get a sliding scale that can go all the way up to an additional $15,500. So basically they end up with about $21,000. And that will be based primarily on capacity of who they can serve. So it's going to be a pretty big lift here in a couple of weeks when we close the application process and apply all the criteria, and probably still have way more than we can possibly fund. But we are trying to be up for the challenge, and we know how incredibly important it is. One last note I'll make is that a lot of other people have stepped up to try to fund around the edges of all of this. We have a construct in Minnesota known as the Initiative Foundations, and they are economic development entities around the state, roughly set up like we are, using the same similar regions. And then we have a large agency in the Twin Cities, which happens to be our child care aware agency. Think small, but they also serve some statewide needs. Those different groups together have all been kind of the funnel for foundation money and private money. So they too have been running some smaller grant rounds of $1,000 to $3,000 to help supplement. So I think we're trying to do the approach a lot of you, I'm sure, are doing, which is look under every rock, try to figure out where we can patch things together. And of course, now that the good news is finally starting to come out that some of the federal resources will be available to particularly our family child care community, they do not qualify for regular unemployment, but we're excited to see that maybe some of these newest resources will help them. We are feeling a little bit better about being able to say we're going to connect you up, or at least let you know about other resources. I think that's about it for me. I think I'll just close by saying two things. Number one, and I'm really not to that place of trying to always find the silver lining per se, but I will say that as an agency and a system, this has been a chance to sort of remind folks who we are and what we do. We've been so identified the last few years with only our quality rating improvement system that I think people forgot that we actually have a core and ongoing role to support parents. That we do other types of grants, that we have this system. We are using our regional and our district sites to do some of the follow-up on the grants, to make sure they have the information about health and safety, to make sure they have what they need, to get more information about how it's going. So we've got this great sort of instant infrastructure that we are lucky enough to be able to call on and to have some base funding to run. And then lastly, I'll say, as I mentioned before, it's been a great opportunity to find some common ground across a huge range of advocacy organizations. Our Children's Defense Fund of Minnesota has been weekly convening. I think sometimes it's been as many as 50 organizations, certainly not less than 30, coming together, sharing intelligence, doing a massive advocacy effort to get that bill that I just mentioned passed. And I am really hopeful that that group can continue to work together to keep, again, addressing this longer range issue of how do we support and strengthen and build back up, most frankly, our childcare system in Minnesota. I will stop there. Thank you.
And thank you so much. And thank you to Allie for presenting this tremendous information, and just really, really impressive what you are doing in your states. All of you in the states are working incredibly hard, and we're grateful for all that you're doing. I will pause now. I know folks have been putting questions in the chat box. I will just point out that a recording and a copy of the slides will be going out to the participants. So if I think sound went out for a few folks, if your sound went out or you had other, if you had a conflict with this particular portion of the presentation, you'll be able to check out a recording later on. I would also really urge folks to go to childcareaware.org. We have a state-by-state map with information about what's going on in each state, so you can poke around there. Some of the questions have been state specific, and we have a coronavirus resource hub that gets into some grab and go adaptable materials for childcare providers and lots of other resources. Some information about the Small Business Administration programs, loan programs, that some of which are kicking off today. And would urge you also to check out the map. We have a map that we've done in partnership with Yale that demonstrates the demand state by state for childcare for emergency personnel. So you may find that useful as well. Mindy, I wanted to check and see what if there's any more questions.
Yes, this one is for Anne. The question is, they want to know who built the emergency childcare website in Minnesota.
So I'm not sure which one you're referring to. The second one we had pulled up is actually our Childcare Aware of Minnesota website, and we built it internally, working with our designer, our behind the scenes to build the application process. That was done through the firm that creates the back end of our website, but we have staff that do web work in our office. The other one that was the first one we pulled up is actually coming straight from the state. I'm glad you asked, because it gave me a great chance to, if I didn't already say, what an incredible partner the Children's Cabinet has been. So the Governor's Children's Cabinet reports to, or is under, what we call Minnesota Management and Budget. They've got really, really smart data people there that have been, I mean, so quick on the draw. And all the steps of our grants have been negotiated between that office, the Children's Cabinet, which is basically the governor's office, the Department of Human Services, and us. So we've never worked this closely, quickly. Yeah, that was one of the other kind of silver lining, if you will, out of this, is that we built an incredible and fast relationship with those entities. And it's the governor's Children's Cabinet and the Office of Management and Budget that are maintaining that other site that had the searchable map and the updated information for providers as well as parents.
Great, thank you, Anne. Here's another one that goes for you. They want to know how you're administrating the emergency grants. Are you literally negotiating a contract and sending checks to each of the providers, or is there an alternative payment process?
Yeah, so we really fast is the answer. No, what we're doing is we made the application process as simple and straightforward and the least amount of questions we could. That was that was important. What we will do, because again, we're probably going, my guess is we're going to have 6,000 applicants. And I know $30 million sounds like a lot of money, but if it's monthly across 3 months, you quickly get down to, and even the governor's supplemental budget that kicked this off said maybe 1,000 to 1,200 that we can fund, depending on the mix of family childcare and center and size. So we will, once we've chosen awardees, then they will be required to fill out some attestation language, is what we're calling it, where they agree to all the different criteria, submit their W-9s securely, and we can either do checks, or because we saw we knew we were moving to working off-site. I should keep saying we're doing this completely off-site, by the way, but we have the ability through, we've set up quickly the bill.com, I think it's called, or billpay.com. And so we can either have checks or actually direct deposit if they are willing or will want to set that up. So we're doing this quickly, and then we're lucky enough finally to have in our office, because we normally are doing, as I mentioned earlier, their quality rating improvement system. One of the grants or contracts we have is for the last step of that process, which is the review of all of the documentation. Those are contracted employees, and we were worried about being able to keep them busy because a lot of our Parent Aware, our QRS, is kind of on hold right now. We've pivoted them to work on scoring these grants. So it's worked out really, really well. We have people with that skill set and that kind of background already, and we can put them to work, and actually already are, in scoring these applications as they come in. So there you go.
Thanks, Anne. This one's for Allie. What is the estimate of what this will cost the state of Vermont?
Great question. I also have a logistical question that maybe one of you can answer at some point. I have some questions coming into me, and I don't know if you want me to send to all my answers that I've typed up or send privately. But in the meantime, it's going to cost about $1.3 million per week is the estimate. Now, remember, Vermont is a small place. We have 650,000 people. We have 35,000 kids under age 6. So we are a small place. So to do this work, it's about $1.3 million. That's the estimate for covering the cost of the 50% tuition. So it doesn't take into consideration the paying for 100% of tuition for families that choose to unenroll their kids from their programs at this time. So, you know, the state has put aside at least $15 million as its first guess of the 1.3 million for how long this is going to last in the next few months, probably, is what they're at this time estimating.
Mindy, I'll turn it to you for more questions.
Absolutely. To answer your question, you can go ahead and reply to all as you answer any of the questions that are in the question box.
Right.
As I move on, Anne, they want to know if they're able to share the Let's Not Forget Childcare Workers Behind Essential Workers graphic within their own states.
I think that was Allie's.
Oh, very good. So sorry.
Yes.
Allie.
Absolutely. That would be wonderful.
Good, because I'd like to have it too.
As I'm looking through here, we're getting a lot of questions about other states. Please know that this is a webinar series, so we will be highlighting additional states. Next week, our states that we'll highlight are California and Indiana. Obviously, we won't get to every state, so as Ami mentioned, please go to our website for additional information as you get it. We have several really specific questions that are coming in as well. This one is for Ami. Congress hasn't met the $50 billion recommended by Child Care Aware yet. What's next, and what are the prospects for securing additional federal emergency funding in future legislation?
It's a great question. So you're absolutely right in that the $3.5 billion through CCDBG that was provided in the CARES Act, signed into law a week ago, is a down payment. We view that as funding that can be used in the immediate term to address some of the programs and ideas and crises facing all of you at this current time. But we want to all make sure that we have a healthy childcare system to come back to, and this is a system that was already underfunded before the pandemic even hit. So what we are now pivoting to is advocating before Congress to turn to a fourth stimulus bill, and our ask is for $50 billion for the childcare system, the childcare industry, to receive to be able to build back up. We are busy educating members of Congress about the impacts in workforce, the impacts to home-based childcare providers, and to everybody else in the system from the effects of the pandemic. And so what we would really urge folks to do is to go to our Take Action and spread the word on that. That Take Action, again, if you go to childcareaware.org, scroll down about halfway down the page, you'll see a box that says Take Action. That Take Action is a simple message that you can click through and send to Congress. We really want to send a large number of messages and emails to really turn up the volume, and so Congress hears us that this is what's needed. A lot of industries are getting a lot of help. We would like childcare to be one of them. And so please do take that action. Please feel free to share that action with your networks. We have also been able to, there are certain CCR networks in certain states, like Think Small, for example, in Minnesota and the Twin Cities, that has sent out that action to its networks. So we would urge you all to do the same.
Great, thanks, Ami. Here's another question. What funding sources for Vermont using to pay for the Child Care Stabilization Program?
Such a great question. And to be honest, we don't have a full answer for that yet, so we can continue to give information through this group as it becomes clear. And to be frank, I don't think the state of Vermont totally knows yet. I think that's part of why. They've sort of decided they are stepping up to make this commitment, and they will find the money. We have insisted and asked them every which way. Are you sure? Are you going to run out of money? Are you sure? We don't want to be out there talking about this. And we are committed. This is where we're going to put this funding. So they're using, as you can hear, flexibly, their CCFAP dollars. They're using, CCDBG dollars. So certainly they're using all of those. And then I believe they're probably using a mixture of state reserves that are being used for this pandemic and prioritizing them here. And I know they're going to be braiding as much of the federal relief dollars as possible that come in to support this. Likely not just the ones that come in through the child care, side of that, but hopefully other dollars that come in for small businesses support and other things like that as well. So they definitely plan on braiding the state and federal funds.
Great. And sticking with funding from your state, how are they paying individuals who aren't part of the subsidy program? Do you have a system put in place for that?
Yes, all the money that the state of Vermont can issue is to programs, not to people. That's how they're set up. That's how our IT systems are set up. So what's happening is that families are being asked directly by their programs to pay only the 50% of their copay or their tuition. And then those programs are getting the dollars directly from the state to make up for the 50%. So it's basically the program is in charge of issuing the information to the state saying, this is how many families I have enrolled. These are how many are paying 50%. These are how many are unenrolling their children right now. And then the state gives the program that funding directly to make them whole.
And if the program doesn't have children enrolled currently who are through the subsidy program, is there a way set up for those programs to still get some funding?
I'm not sure I completely understand the question, but what I think I'm hearing is, first of all, families can continuously ask for child care financial assistance to be enrolled in our CCFAP program. So if you currently weren't enrolled, you may be formally now enrolled, even if it's a temporary thing for an essential worker, and you can apply for CCFAP if you qualify. And we're continuously, the state of Vermont is continuously adding people to that, to those roles. And if so, you get the subsidy. And if not, you'd pay the 50% like other private pay families are doing. What we did do though in Vermont is make sure that no essential worker is having to pay twice. So if, for example, an essential worker has a child enrolled in a child care program that is not reopened to serve the child, and they have to seek care in another program or at home, they will only have to pay for the secondary care, and the state will pay to keep their space in their currently enrolled program. So the key is no essential worker pays twice.
Wonderful, thank you. This one is for Minnesota. And the question was around how did you settle on the $4,500 for providers? Was there any thought given to potentially giving less so that you could help more providers during this situation?
Thanks, Mindy. That was actually negotiated with the governor's office and the legislature. When I mentioned that we didn't have the final language until the morning of the vote, that would be a good example of someplace where we had some input into drafts, but frankly, we were out of the equation. It was really down to just a five-way leadership back and forth. So I don't know that that's based on anything terribly magical. It was a minimum maybe that people felt that they could live with. A lot of back and forth, as you might imagine, on how much admin could be charged, et cetera, et cetera. So unlike some of the other grant programs where it's completely in the control of the agencies, this is one where we were basically handed we've got some flexibility in how we apply the center-based amounts, that up to 20 or up to 15,500, but the baseline of 4,500 was set in legislation.
Wonderful. And this is a question for both states. we've got an individual curious around how each state is handling continuing training right now during the pandemic for child care providers. So for those providers to still have to do continuing education.
Sure, I can take that first from Minnesota, Allie. We're again lucky enough that our house, well, my house is my office now. Our agency has been the home for 15 years of Eager to Learn, which is our online learning program, and it has always been set up to offer the same courses that our local R&Rs offer on the ground. And so what happened is the first week after things started closing down, we were able to shift a number of providers who were still trying to finish up classes or needed to meet guidelines before some of the waivers started happening. My folks that run that program told me we had one of the highest registrations we've ever seen that week because all kinds of folks found their face-to-face classes canceled and we shifted them to online. We've offered, by the way, we worked with Child Care Aware of America and did a training. It wasn't so much a training as it was a webinar echoing some of the information that first couple of weeks that you put out about childcare and COVID-19, and that's something we've continued to offer. And then, like all of you, I'm sure, we're so busy trying to figure out what things are going to look like next week, much less by the end of June. But the assumption is we can continue to and will continue to offer, to the extent providers both even want to focus on this or need to focus on this, we will be offering online for the foreseeable future.
Excellent.
Exactly the same in Vermont. Yeah, in pretty much the similar answer, which is that you know, as Anne was saying, a lot of people are in such crisis management mode, as you'd expect and will continue to be, that it's a really wonderful role for others to be playing. For example, in Vermont, my Let's Grow Kids program team is finally able to start lifting their heads up a little bit from the crisis response piece and start thinking about this, working with our NACI affiliate, the Vermont AUIC, as well as our Northern Lights, it's called, system, which is through our Community College of Vermont, which does our sort of continuing ed work. A lot of it is already online, and so what we're able to do is, while sort of state folks are really focused on the crisis response, we can start thinking about together, we've already started, how to move more trainings online, how to really promote the ones that are currently there, and honestly take advantage of the fact that a lot of early childhood educators right now are on payroll and eager to do this work right now, while they aren't currently caring for kids and families if they are not doing essential care for essential workers. So we're actually going to be ramping up, I would say, with some sort of private partners here, the ability and options to do remote professional development throughout this time.
Thank you so much, Allie and Anne, for your presentations and this information. I want to thank our audience so much for joining us. As Kiami mentioned at the top, you'll be getting a recording and a copy of these slides. Before we part ways, we wanted to share with you an opportunity to attend a virtual symposium at the beginning of May, so a month from tomorrow, that Child Care Aware will be holding. This virtual symposium will contain a great deal of programming, much of it that will be helpful to you as we're all in the rebuilding phase at that point. And there will be an advocacy component as well, some information both for you to learn about advocating if you haven't done it before, or if you have done it before, the kinds of tips that will make it most effective in this time of crisis. So would really strongly urge all of you to go and check out the registration page. It's at childcareaware.org. And the other thing that I will flag for all of you is when you get the follow-up email with the recording and the slides, you will get a survey in there that we're going to ask you to fill out. We are going to be holding more webinars with more information about other states, as Mindy mentioned, and we would love to understand and get your feedback on making these as helpful as possible. So please do fill out that survey and give us your feedback. If you have additional questions, you can send them to learnmore@usa.childcareaware.org, the email address on the screen. But other than that, I would just really like to thank everyone for attending and thank our presenters, and hope everyone continues to hang in there. Take care.